Joey?
Hello, everyone. My name is Nauman Zahid, and I'm delighted to introduce myself to this esteemed conference. As an educationist, lecturer, speaker, and technology content writer, I have accumulated over 8 years of experience in the education sector. I hold a bachelor's degree in electrical engineering and a master's degree in telecommunication engineering. Throughout my career, I have demonstrated a deep passion for advancing the education sector by incorporating innovative technologies to improve the learning experience for the students. My dedication to this field has helped me to become a prominent figure. One of my areas of expertise is immersive technologies. I have organized several EdTech sessions, including Pakistan's first ever virtual reality based event, MetaX. These events showcase my ability to drive innovation in the industry. Currently, I am working on a project that utilizes immersive virtual reality to provide psychotherapy to people suffering from depression. This project represents my commitment to promoting mental well being through cutting edge technologies. During this conference, I will be delivering a thought provoking session on promoting mental well being through virtual reality, where I will share my insights on how these technologies can be used to enhance our collective mental health. With my extensive experience and expertise in this field, I believe that I can provide valuable contribution to the conference and the wider industry. So let's explore this topic together and see how we can use these technologies to improve the lives of those in need. Thank you all for joining me today, and let's get started. The recent studies have shown that an increasing numbers of individuals with social anxiety disorder are benefiting from virtual reality based therapy. This mode of psychotherapy is also being investigated for the treatment of patients with anxiety and depression. Despite the prevalence of mental illnesses such as depression and anxiety, many individuals do not seek treatment due to their belief that they do not require it. This poses a significant challenge for the healthcare industry, as the World Health Organization predicts that the number of individuals suffering from mental illnesses, including anxiety and depression, will continue to rise and outstrip the available medical personnel by 2030. Traditional therapies for these conditions can be time consuming, and many individuals worldwide lack the financial means to pay for therapy sessions. While there is extensive literature discussing psychotherapy sessions for depression and anxiety, there is a shortage of medical specialists worldwide. Moreover, the COVID-19 pandemic has had a significant impact on people's mental health, leading to traumatic experiences that often creates anxiety and depression symptoms. Virtual reality technology offers a promising solution to these challenges by providing a unique immersive experience that can completely cut users off from their surroundings and the outside world. This technology has shown promising results in treating mental illness and is currently being researched by numerous scientists. However, further research is necessary to make a definitive decision regarding its implementation, as it is still in its infancy. Despite The need for further study, VR-based interventions have shown significant effectiveness in treating symptoms of anxiety and depression. Notably, while several studies have assessed the effectiveness of VR-based interventions for anxiety and depression symptoms, more research is necessary to explore their effectiveness. As such, continued investigation is necessary to fully explore the potential of VR technology in treating mental health conditions. Now, in this section, I'm going to discuss about VR exposure in healthcare industry. Recent studies have demonstrated the potential of virtual reality to enhance and complement traditional treatment approaches such as cognitive behavioral therapy and exposure therapy. These studies recently published in a journal of mental health, which indicates that VR provides a unique platform for individuals to learn how to manage their reactions to specific stimuli and control episodes of anxiety, realistic 3D environments and experiences that activate. It has been particularly effective in treating social anxiety and stage fright as well. Virtual reality offers a safe and private way for patients to experience simulated environments and interact with therapists in real time. It has also been used to expand the potential of music and art therapy. The authors of these studies suggest that as VR technology continues to evolve, it will become more accessible to a wider range of people and increasingly integrated into clinical treatment. Now, what we can do for mental well-being through VR. Mental illness affects a quarter of the global population, presenting a significant contemporary challenge. Factors such as economic insecurity, societal tensions, and violence have pushed individuals beyond their capacity to cope effectively. Virtual reality therapy offers a new approach to treating mental health by exposing patients to their sensitivities in a controlled environment, as observed in the previous video, with the goal of preparing them to react positively to challenging circumstances. VR therapy offers several advantages over traditional therapeutic methods due to its immersive and interactive capabilities. While it may not replace traditional therapy, it can complement it and provide intriguing benefits such as improving cognitive and behavioral skills. My study aimed to use VR technology to improve the presentation of a digitized rehabilitation for psychological disorders, specifically investigating whether people benefit from a comprehensive reality-oriented VR experience. The proposed VR application offers a variety of psychotherapy sessions, including cognitive behavioral therapy, psychodynamic therapy, and interpersonal therapy from which patients can choose based on their needs. The study also developed an immersive version of the Tetris game for cognitive therapy sessions, as it has been demonstrated that individuals who experience anxiety and have undergone cognitive therapy can benefit from playing the game. Additionally, the study introduced forest treatment in behavioral therapy, where patients can immerse themselves in a calming and serene forest atmosphere to relax and elevate their depression. Cognitive behavioral therapy, CBT, is a systematic, time limited, and directive method of treating mental health issues. Investigates the relationships between thoughts, emotions, and behavior. VR technology offers a gamified setting that may aid people with depressive disorders, with the setting cast in a heroic character to help patients achieve more in an adventurous play setting. Studies recommend that therapy sessions be assisted by a therapist intervention. To this end, virtual assistants are introduced in psychodynamic and interpersonal therapy sessions, and patients can choose from a wide variety of virtual avatars based on their need for talking partner. Interpersonal sessions are held in a hospital setting to address past traumas, while psychodynamic sessions are based in a virtual home environment to address recent traumas through personal concerns. As my session on promoting mental well being through virtual reality comes to a close, since I have limited time to deliver all of this, now, I want to express my sincere gratitude to all of you for attending and engaging in this discussion. I hope that my insights have sparked some ideas and provided some inspiration for how we can leverage immersive technologies to promote mental health and well-being. Remember, mental health is a critical aspect of our overall health, and it's crucial that we continue to explore new and innovative ways to address it. Thank you again for being a part of this session. I look forward to continuing the conversation and working together to improve mental health care using immersive technologies. Have a great day. Thank you.
So Nauman will be joining us right now to talk a bit more about what we just saw. Hello, Nauman, can you hear us? Can you unmute, please?
Hello, good morning. Yes, I can hear you.
Yeah, great. So we just saw your video because we had like 2 technical difficulties with the previous speaker, and so we were able to put your video forward for it. And it's great you managed it to come and join our webinar. And maybe you can look a bit more and expand on what was said in the video already. And again, more about what you're doing with VR technology and trying to treat any mental health issues which can arise from it.
Okay, just give me a little time. Let me just set up my laptop and then I can join it.
Or... Meanwhile, like if anybody has any questions, which they can ask, and to be honest, because we have time, uh, we can have an open discussion about any topics which you can choose. Dr. Joshua Cohen is raising his hand. Is it something you want to join in the conversation? Should I add you as a speaker?
Good morning.
Yeah, hello. You raised your hand, so I thought maybe you want to jump in on the conversation, seeing you're also into the media psychology.
Yes, sir. I appreciate your presentation, and I wanted to thank you for bringing such an important subject to the forefront. I wanted to also compliment you on the vision of something that is badly needed for the future for a lot of conditions, especially anxiety, depression, and post-traumatic stress for military veterans, servicemen and women, and the general public after COVID especially. One of the things that I think is sort of been a limitation of VR for therapy has been the use of creating HIPAA compliance and creating the privacy that's necessary for VR to be effective. Do they have something in place already with your research that could help maintain privacy for people within reasonable limitations? Because there are different definitions of that for each country, of course.
Yeah, I think Nauman right now is setting up his equipment. He's also having technical difficulties. So maybe when he's back, just repeat the question. But while you have the floor, maybe introduce yourself and tell us like what you do and what you mean by your medical psychologist and what is the work which you're doing.
Sure. The work that I do with well, specifically, I have a trademark on something called film and video therapy that allows me to. I've done research on how to include making movies as part of therapy, and I've been extremely interested in virtual reality to help make that happen, especially with the invention of the Unreal Engine and some of the pre-visualizations that you can see in Hollywood. There's a lot of work that has been done to do location scouting with VR, pre-visualizations, as well as making actual movies now with virtual film sets. And so some's been published on that. So I've always been interested in trying to reduce and find ways to make films with clients. And so I published a book, and Dr. Skip Rizzo, who's a medical virtual reality uh, doctor at USC at the Institute of Creative Technologies, has done the foreword. So we're in new territory. I think the traditional techniques of making doing virtual reality the way Skip does at USC with exposure therapy and using CBT is the correct way to use it with according to research, because there's a lot of research behind what you're talking about. So I'm extending it to include narrative, because I think storytelling also has an additional way of complementing psychodynamic therapy. So I feel like it complements what Skip does, and apparently he does as well. But there is no example yet really of what we do fully. There are examples of people making movies along with trauma therapists and using VR in some extent, but it's still sort of new territory. And so I would always welcome, and if anyone is interested in exploring more of this, I'm doing more research even currently at USC, and I'd love to meet you guys and see what your take is on that. And if anyone would like to learn more or join me at some point, I would love to invite more researchers.
Is there any like case or you know, I'm hesitant to call it a patient story, but like any actual like case which you can talk about where you used a movie or like VR therapy on somebody and has it improved or not? Because I think like a lot of people are skeptical about VR in general, and we all know that gaming, as of right now, has certain side effects for people who play it a lot. Like they kind of separate themselves from the real world. If we're talking about like large MMO style games. And if VR is the next step forward, is it also not a dangerous element to introduce into psychotherapy and psychology?
Well, Skip Rizzo is a medical director at USC, and his research has been pretty definitive in showing how to use it with a project called Brave Mind, and that has been very effective for reducing symptoms of post-traumatic stress disorder. So you can, and they have a lot of studies. If you go to Google Scholar and look up Skip Rizzo, you'll see that he's been cited over 20,000 times in his work. And his there's quite a bit of research in what you've been presenting on. So it definitely is pretty valid for what I do specifically. There are case studies, like for instance, there was a film called Game Girls where people went out into the public and interviewed and discussed what it was like to be homeless on Skid Row, and that film started winning awards. The film was taken to film festivals, and then the reason it was in my book is because it did involve a drama therapist that was helping them as well, and so it does kind of involve therapy. We have some cases with cancer studies that are case studies in there as well, about how narrative and building narrative can actually help cancer patients with like anxiety, depression related to medical conditions. And then there's some other studies that are not studies, but some other commentary that takes film from an interpretation of like a Jungian or depth psychological perspective. So there's a few different viewpoints, and one of them actually is from Italy that has a viewpoint of um, what it's like to go through separation and divorce. And he uses what he calls video movie therapy. There's a lot of different names for what I've come across, and different people like art therapists use it, different expressive therapists use it. Everyone has a different name, it seems like. There's therapeutic filmmaking, video art therapy. So we kind of put it together into one book to kind of, I use film/video based therapy as a way of kind of, just an overall umbrella. But if you look at it on Wikipedia, I included the other names on there so that people understand there's a lot more to this, and different kinds of variations, different countries, different people. And I wanted to accommodate, at least, recognize all the different kinds of different ways of using narrative. The only reason VR comes into play is because how do you do this without VR? And it's a very different approach, because it's not about exposing someone to it necessarily. It's about having them create an environment and then exposing them to that environment that they've created. So it still would, I think, make use of the research. So that's kind of what I'm in the middle of right now. And the book is already out. The first volume is on film/video based therapy and trauma, and it's more about the theory of trauma than the technology itself.
And where can people get this book if they're interested?
If you type in film/video based therapy and trauma, it'll come up right away, but it's on Amazon, Kobo, Barnes & Noble, Walmart, Google Play. You can find it through Goodreads. You can even get it at the library. The textbooks have it. And you can get it both as a Kindle, like a virtual reader. You can even rent it if you don't want to don't get the hardback though. It's too expensive. That's for libraries. Get the paperback or the Kindle, because it's like $50 to start with, but you can rent it for like 20 or get it for free at a library. You know, you can't get interlibrary loans. So I'm not really interested in making money off of it as much as I am as getting the information out there right now.
Well, I think most of the people on our conference are from all over the world, and maybe not all our libraries have it yet.
Yeah, it's only in 83 libraries because it just came out in December. So it will be available probably easiest through interlibrary loan. And, you know, that's because that's the cheapest, it's free, but you just go to your local library and then order it. I don't think it's on overdrive. That's to get a physical book. I've also included in the book a website. I don't know if the chat is open, but I could, yeah, it is. I'll put the link to all this in there because then you can get all that information from here, and I'll link to the book as well, so you can see it from the publisher's website. But it would be available in a lot of different formats, so it's not, you don't have to get it from the publisher, although that's just the easiest way for me. But your research is right on track with a market that is going to be worth probably about $7 billion by the year 2026, because the need for mental health is so high that they can't fill it with even the telehealth that they currently have. And so it's a matter of the demand has gone so high for this kind of support that doing VR with cognitive behavioral therapy and the visualizations that people are doing are so important that this presentation is going to be really important for developers, I think, to understand how to work with mental health practitioners in developing software that continues to be HIPAA compliant and ready for the privacy laws in each country that will allow them to really implement all kinds of therapy quickly and effectively by 2026. If any other reason, not just to help the public, but because it will make them a lot of money when they get this right. The market is huge.
Yeah, but then we still have, like, from the business perspective, the problem that VR hardware is still expensive, and it's probably not going to go expensive. Well, it's not cheap enough in the next couple of years. And if for people who need help, I'm sure it's going to make the cost of getting VR help and VR psychology and psychotherapy for them to deal with their trauma or problems or any issue which they can have. It's going to make it more expensive type of therapy and help.
Yeah, the companies like Sias, formerly Sias, now Amelia, have started working on those kind of issues. They do have VR headsets that you can use with their app that allows you to put a phone inside of it, you know, just like the old kind where you would just get like a plastic headset for $17, and their app is what makes it, what drives their product. But they also have professionals work with the Pico Goblin as well for the professionals. So that kind of addresses that issue fairly well because one, I think the privacy issue is just that they're not doing therapy when they just do exposure images. But what I love about Sias is that they, you know, they have the professional Pico for the practitioner. So you still have to be in person to use it, or you still have to have one for the therapy. But to take homework home, you only need a $17 headset. That's great. Because as long as they have their own phone and they can download the app, they can still use it when the practitioner is not there. But to get the full, you know, biofeedback and the skin response and temperature regulation, you need to be with the person either in person or have access to the headset for the therapy. And they have a professional package for that. The name of that company is called Amelia, and they're really good.
Just like, do you think this can be applied to all sorts of issues which people face?
Yeah. I do. I've seen it with King's College has a research study that worked with bipolar disorder and psychosis, and there are other more serious, mental illnesses like that um, that go beyond anxiety, depression, that this can help. So if done in a proper setting, then yeah, absolutely. And we're working on that at USC to try to, come up with new and innovative ways to involve peer support and to try to, there's a company that I'm going to put that in chat too. It's called Peer Mental Health. And I worked with them in NeuroTree that helps with chronic pain, and one helps with peer support. These guys are really amazing, and I definitely stand by them as well. They definitely have found a way to get paid, because this is a business, to do work that involves virtual reality development as well as gamifying mental health, and using peer support as a way of helping people. So the state of California has approved a way of using peer support specialists, so they can actually get bill off of Medi-Cal without being even a practitioner, but they do have to go through a certification process. And that's all done through VR as well with what they do. So they're really kind of leading the way on some of the ways to do it. Companies like Sias, now Amelia, is really helping, to show that it can be affordable. And once people start, competing and showing different ways of doing this, I think we can actually improve the price point and also get more precise in how people can be aware of it. Right now, I don't think people are even aware of this market. That's kind of a problem for people like me, because I'm not only am I not competing against anyone, no one's even aware that I exist. And so it's like the SEO and the design of like trying to, if I were up against someone, it'd be different, but like to use movies as therapy, no one's even looking for that. So there's no market yet. But to try to do it as exposure therapy would be the first way out, and for people to get interested in how VR can help them. Because it is used a lot in certain markets, but I think the best way to market it would probably be to the patients first, to create the demand, so that they're going to their therapist and saying, I want this. And then the therapist will say, well, my patients want this. I think I need to demand it now. And look into these companies that can supply it for them.
Well, I think you mentioned important problem. Like, again, I spoke about this with Arthur yesterday on our webinar. Like, when we talk about those types of technologies, we're all kind of talk about them because we're in this bubble of VR and NFTs and crypto and the metaverse. But for the wider amount of people, they don't even think about it. They don't even know that those technologies exist. So how could right now clients and patients go to their doctors and ask about using, well, effectively experimental treatment?
I think that, getting the doctor to be aware of it would involve saying, I want to take some of this home, or sorry, I had something up there before. I think just the question of going to a primary care doctor and asking them, how do I get a specialist for, virtual reality therapy would be a start, or a mental health practitioner. You go to, but it's hard to even get to a psychiatrist these days. So if they started with their primary care with the symptom, I have anxiety, I have pain, I have whatever the symptom is, and then just said, can I do this from home? Like, for instance, USC does most of their work right now from telehealth anyway. So I think it's very natural that the next step would be, they could start sending out headsets once where people could invest in it themselves. I'm not sure if the insurance would cover it. They'd probably try not to, but if it improves patient care, and it's something that could be covered, I know that the insurance would be able to cover that eventually if worked out properly. Because think about it, they supply like CPAP machines to people that have a need for treating sleep apnea, or any other condition. If that becomes part of what you need, then VR headsets could be considered like something they could compensate for. So I think the question becomes more about the software development, and the need of it could be communicated through, I believe, the patients to start with. But then there also needs to be a proper software and hardware, developed for people. Otherwise, the demand will be there, but then there won't be the right equipment yet for them. So it does need to be communicated to developers as well. But if people really could, get that message out to the doctors and show that this demand is really in need and it's available, then I think the market will spread quicker and more effectively to the people that need it.
Sure. Well, do you have anything to add to it? Because we'll be slowly changing to our next presentation soon.
No, I just appreciate that you guys brought this up, and I wasn't actually expecting you to speak, so I appreciate you putting me in on the panel today. And thank you for your time. You guys are awesome. Thank you for allowing me to speak on this, because it is an important subject.
Well, thank you for speaking and raising your hand. And we wouldn't have otherwise noticed that you wanted to have a say.
Because I did notice you had the chat was off at the time. And I thought, well, maybe we could use some other way to get their attention. But yeah, thank you again. And
Sure. Thank you very much. So guys, in 20 minutes, we'll make sure the speaker is there first, and we will be having our next talk about how marketing and selling your product works in Metaverse and Web3 space with real world use cases. So hopefully see you there all in 20 minutes.
awesome.